We also want to thank you today for continuing this ongoing set of hearings on opiate abuse. In Maryland, it is indeed a public health epidemic and a public health emergency. Close to 600 people in Maryland died last year of an overdose. 50% of those were in Baltimore City. In Baltimore City last year, we had 300 people die of an opiate, a drug overdose. We also had 300 people shot, usually related to drug gangland type killings, some of whom were children who were caught up in street massacres that were shot when sitting on their own front steps. Our governor, a Republican governor, says this is a public health emergency. No matter what county you go to in Maryland, this is indeed an epidemic. So we have one of our rising stars in Maryland, Dr. Leana Wynn, who is the health commissioner in Baltimore City, to come and share her experiences and yet her solutions that are really showing results in our city. We're very proud of Dr. Wynn. She is the head of the Baltimore City Health Commission. 1,000 people work there, and it handles everything from maternity and child health to behavioral and drug addiction issues. Since her appointment in 2015, Dr. Wynn has led the implementation of citywide opiate overdose prevention and response plans, including innovative ideas like hotspotting and street outreach teams that she's going to tell you about, how she trained police officers and lay people in terms of being able to respond to this crisis, and launching a significant public health education program. She has done an outstanding job there, and during our recent uprising, she led the public health recovery efforts, ensuring that prescription medications, the legal drugs, were in the hands of the senior citizens, the diabetics, the others who needed it, and really helped lead. She was like a medical FEMA out there during these very difficult days. She comes from this background, yes, a brilliant academic background, a Rhodes Scholar, a consultant to the World Health Organization, but her hands-on practice started as an emergency room doctor. And seeing what all comes into an emergency room, all of the trauma, the injury, and the human misery, led her into the field of public health and prevention. You're really going to you'll, I think, enjoy listening to her, and I think she will give us the kind of specific recommendations we need. I'm proud to introduce her to the committee as a Baltimore hometown girl.